Hello, we are Cooked Coders and we are here to present our solution for problem statement 25083 in the software category. India's 45 crore migrant workers are the backbone of our economy, yet they face critical healthcare challenges lack of proper documentation, language barriers, limited access to medical facilities, and absence of centralized health records. Problem statement 25083 specifically addresses the need for a comprehensive digital health record management system for migrant workers in Kerala. Today, we present Swasthyam, a revolutionary solution that bridges this healthcare gap through cutting edge technology and ensures no worker is left behind. Let me walk you through a basic workflow of our solution. Our solution creates an intelligent health monitoring ecosystem for migrant workers through three integrated components. Migrant workers register via mobile app or QR code, creating secure digital health profiles with unique IDs. Offices such as site managers, supervisors, NGOs, and healthcare workers record daily health data of these migrant workers. AI analyzes risk levels green for healthy workers, orange for moderate risk and adjusted work capacity, red for high risk cases triggering immediate medical intervention. If a worker fails to report, payroll and attendance are automatically adjusted, ensuring compliance. All data feeds into a government analytics system dashboard for real time monitoring, resource allocation, and policy planning. This workflow transforms reactive healthcare into predictive, preventive care, supporting UN Sustainable Development Goals by promoting health, reducing inequalities, and building sustainable, resilient communities.
I will walk you through the prototype of Swasthyam that we have made. The process of logging in for a migrant worker is very simple. They can either do it through DigiLocker, through the unique QR code that each migrant worker will have, or through the way I'm doing it now, using a phone number and an OTP. This is a disclaimer that any data that we have used in this website is all mock data. It is generated by us because we do not have access to databases yet. Migrant workers dashboard will display all these things and they can directly contact the healthcare officers. The migrant workers will only be able to view their data, there will be no editing. Only the officials and the supervisors can edit the migrant worker data and only with proper verified documents. This is how the supervisors, healthcare workers, construction site supervisors, or NGOs will log in. This is what the supervisor dashboard will display. It will have a list of all the migrant workers that are under high alert. There are three types of risks: healthy migrant workers, moderate risk, and high risk. And the high risk migrant workers will be the first ones in this list. The supervisors will have access to all the migrant workers that will be under them. They will be able to register new migrant workers using a 3-step registration process. This is how it goes. We integrated AI for voice to text integration. Let me show you an example. मुझे डायबिटीज है, मैं पैरासिटामोल खाता हूँ. As you can see, the website extracted health keywords such as diabetes and paracetamol. Now once I've clicked Analyze Health Data and Generate CSV, the website will now generate an Excel sheet of all the data that I have used. Once I open the Excel sheet, the parameters that I entered using voice, like diabetes and paracetamol, are all displayed here. Once the officers submit the registration of the migrant worker, there will be a unique special QR ID and a QR code for every migrant worker. Then they can use that for logging in every single time. There is also an emergency support helpline for the officers that they can directly call in case there is an outbreak of the migrant worker in front of them. There is also a dashboard for the government officials who will be overseeing this entire process. They will have an emergency alert system, and whenever there is an outbreak of diseases, they will be the first ones who will be notified. They can generate reports. They will have areas under them which will then contain all the data of the supervisors and the migrant workers under them. For example, if I click on Thiruvananthapuram area over here, these are the supervisors which are under that area, and these are the mock number of workers which are under this particular supervisor. And this is how the data will be placed. The officials will also have access to a health analytics dashboard, which will have analysis of all the diseases that have been happening recently according to the areas. There is also a process for officers to register themselves in case there is a new officer, and officials registration in case there are new officials in the government.
So, to conclude, Swasthyam is an AI driven health management database platform designed to make migrant healthcare proactive, preventive, and inclusive. We look forward to the opportunity to take this vision further and demonstrate its true impact as finalists. Thank you.